Hello once again. This is your sharing doctor, Dr. Daisy Tay, and tonight I'm going to share with you, as promised, how to do the coffee enema. The coffee enema that I'll be discussing is different from the Gerson type of coffee enema and the usual hospital coffee enema. This coffee enema was developed by an oncologist, Dr. William Kelly of the United States of America. But he was not really a doctor of Western medicine. In fact, he was a dentist whose research led him to the works of Dr. John Beard. And from that, he was able to cure thousands of patients, more than 3,000 patients. He successfully cured of cancers. Different people, different patients from all over the world, from Europe, from America, from the Philippines, and from other countries, went to him for cancer cure. He became very successful that one of his patients who he successfully cured was Steve McQueen. But this also led to a lot of trouble for him. And he finally died with a broken heart. One of the doctors who investigated him was a doctor, a Western medical doctor by the name of Dr. Nicolas Gonzalez. Nicolas Gonzalez, after observation of what Dr. Kelly was doing, became convinced that his cancer protocol was the best, and he adopted it and practiced cancer cure the Kelly way in New York, and he also became very successful that one of his patients was the Hollywood actress Suzanne Summers. Unfortunately, in 2015, he died of a mysterious death. So, let's now go to the Kelly's coffee enema, or the materials that are needed here are ground organic coffee, not the instant coffee. You also need coffee enema kit, which you see on the other side of the screen. There is a bag which will contain the coffee enema, or sometimes a small pail that will contain the coffee enema, and there is a catheter with a flexible tubing about number 18 or number 20. The length of this flexible tubing is about 15.5 inches. So these are the materials needed for your coffee enema. The next thing to understand is prepare the patient. First, the patient should be free of gas. The patient should have defecated in the morning before breakfast is the best way to do the coffee enema. Otherwise, if there are feces in the large colon, it will block the passageway of the coffee enema into the colon. So that is not a good thing. You have to prepare where the coffee enema will be done. Of course, the best place is the bathroom or the toilet. But if the bathroom is small, then you can do it beside the bathroom preferably near the door of the bathroom or the toilet. Lay a blanket where the patient can lie down and put a pillow so the patient can lay down with a pillow on his or her head to make him or her comfortable. Hang the coffee pail or the coffee bag with the coffee enema on a stand so that it will flow into the colon by gravity. Then insert 15 inches of the catheter into the rectum to the colon. Let the coffee flow into the colon by controlling the control valve, pushing and pulling it so that the coffee can enter the colon little by little. This will avoid the rushing of the coffee, because if it rushes into the colon, it will not be able to be retained for 15 minutes as necessary. Once the coffee is inside the colon, you need to empty all the coffee into the colon. And once all the coffee is in the colon, you have to pull out the catheter and then let the patient lie on the left side for 5 minutes, then on a supine position for 5 minutes, and then on the right side for another 5 minutes. The whole purpose of this turning around is to be able to circulate the coffee in the colon. As the coffee circulates, the liver and the gallbladder contracts. Now the liver, as we know, filters 100% of the blood. So as it contracts to prevent the coffee from getting in, it dumps the dead and rotting cancer cells into the gallbladder. And the gallbladder contracts and it dumps the dead and rotting cancer cells into the colon. And then, as it gets into the colon, the patient has to dump it also into the toilet. So that's how the coffee enema gets rid of the dead and rotting cancer cells. As the dead and the rotting cancer cells are flushed out of the body of the patient, relief from pain, from fever, from nausea, from headache will be felt by the patient. Removal of these dead and cancer cells are truly a great relief. With this feeling of goodness, the patient will look for more coffee enemas. In fact, some cancer patients do 8 coffee enemas every day, while others, they just do 4 to 5 coffee enemas, depending on the condition of the patient's health. What is the mixture of the coffee enema? Use 1 tablespoon for every 32 ounces or 4 cups of water. Boil it in a percolator, and instead of drinking it, then use it for coffee enema. Remember, it should be an organic coffee, not the instant coffee. Another thing is, if you do not have a percolator, use it the traditional way. Do not use an aluminum pot. Use glass or stainless steel or ceramic pot for boiling the coffee. Put it on a stove and let it boil. Once it boils, you have to let the coffee boil, and once it boils, turn down the heat and let it simmer for 10 minutes. Then let it cool. You do this in the evening in preparation of the morning coffee enema. In the morning, you don't need to reheat the coffee, but you have to strain the coffee. So you have to strain the coffee ground out, and then the coffee is now ready for use. Use a room temperature coffee, not warm and not cold, because if it is warm or cold, the body will have difficulty retaining it. So it should only be at room temperature. Now, after the coffee enema, take probiotic. Probiotics should be of multiple strains to replenish the lost gut microbiome or good bacteria that are usually flushed out with the coffee enema. Those without cancer may ask, is it all right to do coffee enema even if you are not sick? Yes, because this is a form of detoxification. You see, many of us do not remove our fecal waste the way we should. Honestly speaking, we have to remove our feces 3 times every day. But some of us, we just do it once a day or twice a day. So what happened is feces are left in the colon like we have a sewerage. So doing coffee enema, let's say once a week or twice a week, is detoxifying our colon, detoxifying our liver, detoxifying our gallbladder, and we will be free of many health issues like colon cancer, like liver problems, or gallbladder problems. With this, I thank you, and again, may God bless you. Join me in my next video.